Welcome back to my channel. This is Nasu with Fight for Kidneys, where I come here to bring awareness and inform you guys about kidney health, how to protect your kidneys, and if your kidneys have failed, what are the treatment options that are out there. Today I'm here to talk for a different topic that also affect people also with kidney disease. And if you're there and you're suffering from something that sometimes you don't even know what's going on, you could be suffering from what we are going to talk about today. And I always say, most of the topics that I bring to you guys, anything that I touch, it's what I see with patients who have kidney disease, or yes, I'll say people with kidney disease. And sometimes, like the topic I'll be talking about today does not mean it only affect people with kidney disease. This can affect any one of us. Any one of us can be affected. And without wasting more time, let's get into business and let's talk about the condition that I'm about to address today. So today I will be talking about a condition that is called hypothyroidism. Or hypothyroidism is a condition where your thyroid gland is underactive. It's not functioning as it's supposed to do. And most people wonder, where's thyroid gland, or what's that? What does that mean? So to make it easy, so a thyroid gland is located on your neck, right somewhere right here, and it's a butterfly shaped. And I'll show you. So that's the thyroid gland. It's butterfly shaped and it's located right on your neck. All right, so what happens and why? So this thyroid gland is small, very small, but a very powerful gland in your body. That without that gland, and when it's not active, or when it's underactive, when it's not producing the hormone, the thyroxine hormone, then it makes your body slow down. It makes your organ not function to their best. And this hormone, it produces the energy that your organs need to function to their maximum or to their best. So most people wonder, Susan, how do I know, or what are the symptoms, what are the causes of the thyroid gland to be underactive, to not produce enough hormones? And most of the time, most people don't know. And I keep saying, that's why I come here and I tell you, always when you go to your doctor, get as many tests as you can. Don't wait, and prevention is the best cure. If you can prevent so many things, that way it will help you from going through the other expense of treating the disease. So if we get informed, if we are aware about our bodies, our function, our body function, our status of our body, then we'll be able to protect and prevent things from getting worse. So like, for instance, before I go back to the topic, like you might have a headache and you keep assuming that headache, but that headache is telling you something else is going wrong with you. And until you go get tested, that's how it shows, like, hey, it could be this, it could be your high blood pressure, it could be this happening. But if you never get checked, then whatever else that was the headache was giving you triggers will carry worse, and then before you know, you need such a major surgery or you need such a major treatment. Okay, let's get back to where we are talking about thyroid gland. And the question was really who are the people that are at risk for hypothyroidism, or who is at risk for low thyroid hormone. Most people, all the study or research shows that people at the age of 60 are at high risk. Anybody above the age of 60 is at high risk. Women, more than anybody else, they are at a higher risk of getting a low, their hormones, their thyroid gland being underactive. People who have had surgery, sometimes people have hyperactive thyroid gland, and then they go for surgery and it get removed, and that means then they have to be put on medicine or something else, and then that one then make it it's low. So when it's low, then they start having these other problems. So the first issue was higher, they had other problems, and then now it's low, then they remove it and it become low because it's not producing the hormone that the body need. The other people that will be at risk is if you had radiation allowed your neck, on your chest, and allowed your thyroid gland. So it could be somebody had cancer, a throat cancer, or some any other kind of cancer, and allowed their chest, allowed their thyroid, allowed their and around their neck, and they go get radiation that can damage the thyroid gland, and that means you'll be at risk for low thyroid gland. Even also family history, that's what I think so much about family history. Know your family history. Ask the doctors when you go, ask your parents, try to figure out what other problem are they having, and keep chatting that, because you never know if there's a history, family history of thyroid disease, then you might be at risk for that. What are the things that might cause? And this one I am going to touch just a little bit about it, and the diseases that can cause hypothyroidism. And the reason why I'm touching about these few things is because they also affect kidneys, what I talk about all the time. So if you have type 1 or type 2 diabetes, then that can cause your thyroid hormones to not function as it's supposed to be. Rheumatoid arthritis can also cause your kidney, your thyroid not to function as it's supposed to. And then lupus, and that's an autoimmune disease that can also affect your thyroid. What are the complications? And I know most people are like, okay, so you're telling us we are at risk. What are the complications? One complications, and I'm not touching on any other complication. I'm touching on this one because I know if this is happening and it's high, it's gonna affect your kidneys too. So this is, if you have low thyroid hormone or is underactive, then it makes your cholesterol go high. So if you have high cholesterol, you're doing all the diets and you're working out, you're doing everything, and your cholesterol, every time you go to the doctor, they tell you your cholesterol is high. Next time, ask them, can you check my thyroid hormone? What are the symptoms? What are the things that people might think and wonder, oh my goodness, do I have this? And these symptoms also, they go with kidney disease that I talk about all the time. So one sign is fatigue. You feel tired, you gain weight, and this too, don't panic. But if you feel you're tired and you're gaining weight, that could be another cause that you need to be checked. You might see you're dieting and doing all this and this and this, and you're still feeling the same, you're still gaining weight. So you might ask your doctor to check your thyroid hormone to see if it's functioning as it's supposed to be. Is it producing the hormones as it's supposed to be? If you have, like, people, you go every time you're chills, you're cold, and let me tell you, those people, because my co-workers, I tell them, I'm always cold. I don't know, I might need to get checked on that one because I'm always cold. But if you're extremely cold, even when you bundle up, even when you're outside, when it's 80 degrees outside, you're still feeling cold, then you need to get your thyroid hormone checked. If you have joint and muscle pain, if you have very dry skin, if your hair starts thinning, or your skin is dry and your hair is thinning, that's another sign of low thyroid hormones. And for women, if you have heavy or irregular menstrual period, that's another sign that you need to check. Also with low thyroid hormone, like I said, it gives energy to everything. So if it's low, it could be the cause of some problems to do with fertility. And if you have also lower heart rate and you don't know why, you have had everything checked, you have gone to the doctor, they had put EKG, they have done echoes, they can't even find out why your heart rate is low, most of the doctor will check it. But if they don't check it, ask them, can you check my thyroid hormone to see how it's functioning? And the other thing is depression. So if you're feeling depressed all the time, you take medicine but you still feel depressed, then you need to get your thyroid checked too, you know, on top of other things. I'm not saying this is exclusively, this is the problem. I'm just saying, if you have checked everything else, all the boxes are checking, and there's still that missing puzzle, it could be your thyroid gland that is underactive. And most people wonder, how do I get tested? With everything else, with the symptoms and all other things, physical test, there's also the blood work, and the blood work is the most definitive test that can tell you exactly what it is that is causing you, whether there is the thyroid gland. And let me tell you this, especially if you're in US, that's one called, if it's not coded the right way, so you have, I mean, and this is not for you, but always make sure you are talking to your doctor about it, getting coded for the right way, so when it gets to the treatment, you are being treated and the insurance is not going back and forth. Because I have seen it, if you don't have the right ICD code for this, then it's a back and forth with the insurance company. And what are the options? If you have the low thyroid hormone production? The one major treatment, or the one common treatment, is to get a thyroid hormone replacement. It's a small pill, you might take it, and you have to keep getting blood works, because they have to keep testing it and making sure you are getting at that therapeutic level. So you take it for sometimes, and you have to go back to the doctor, and they might have to give you an extra dose, or bring your dose up, or they might have to lower the dose. So that's something that you have to keep getting checked. So thank you so much for watching, thank you so much for listening, and thank you for being that good subscriber. Continue subscribing, continue sharing, continue liking, and I'm always happy to hear you guys asking me questions, sharing and liking. And until next time, I say goodbye and thank you so much.